Good afternoon, everyone. Thank you so much for tuning into this year's virtual graduation ceremony as we celebrate our 2021 Masters of Science in Global Health Delivery graduating class. My name is Grace Kelly Muvunyi. I am the Student Service Coordinator here at the University of Global Health Equity and also an MGHD alumni. I will be the Master of Ceremony for today's special occasion. I would like to take this time to recognize dignitaries and special guests that we are honored to have with us here today. Honorable Minister of Education, Dr. Valentine Uwamariya. Honorable Minister of Health, Dr. Daniel Ngamije. Dr. John Nkengasong, our keynote speaker. Chancellor of the University of Global Health Equity, Professor Paul Farmer. Vice-Chancellor of the University of Global Health Equity, Professor Agnes Binagwaho. Deputy Vice-Chancellor, Academics and Research Affairs, and the Dean of the School of Medicine, Professor Abebe Bekele. Deputy Vice-Chancellor of Administrative and Financial Affairs, Mr. Rogers Muragije. Dignitaries of the Burera District, UGHE Board of Directors, faculty and staff of the University of Global Health Equity, distinguished guests, graduates, parents, friends, and family of UGHE. All protocols observed, it is my privilege and pleasure to welcome you all today to the 5th degree granting ceremony of the University of Global Health Equity's Masters of Science in Global Health Delivery. Today's ceremony will include the following key messages. Opening remarks from Deputy Vice-Chancellor, Academics and Research Affairs, and the Dean of the School of Medicine, Professor Abebe Bekele. Welcome address from the Vice-Chancellor of the University of Global Health Equity, Professor Agnes Binagwaho. Dr. John Nkengasong, our keynote speaker. Remarks from Honorable Minister of Health, Dr. Daniel Ngamije. Remarks from Honorable Minister of Education, Dr. Valentine Uwamariya. Speech from student representatives of the graduating class of 2021, Dr. George Mkondo and Ms. Oveka Yana. Ceremonial conferments of degrees, and remarks from the Chancellor of the University of Global Health Equity, Professor Paul Farmer. I also want to mention that we will be recording today's entire ceremony and it will be made available on the UGHE YouTube channel. May I now call upon the Deputy Vice-Chancellor of Academics and Research Affairs and the founding Dean of the School of Medicine at UGHE, Professor Abebe Bekele, to introduce the Vice-Chancellor of the University of Global Health Equity, UGHE. Thank you.
Distinguished guest of honor, the Chancellor and the Vice-Chancellor of UGHE, the entire UGHE community, students, faculty and staff, and most of all, dear graduates, good morning, and welcome to the commencement ceremony of the class of 2021 Masters of Science in Global Health Delivery, MGHD program at the University of Global Health Equity. Today is a very proud day at UGHE. Not only because we are introducing our 23 newest global health equity fighters, but also because we are presenting the first 7 inaugural batch of graduates in our One Health track of the MGHD program. I would also like to mention 13 of the 23 graduates are women. I'm here today to convey my few words of congratulations to the graduating class of the year 2021. Dear graduates, so here you are. All your hard work, dedication, resilience, and care has finally paid off. I'm incredibly proud of each and every one of you. While you continue to enjoy this well-deserved success, let me remind you to first and foremost thank your families and friends. They stood by you, supported you, and today they share your joy, excitement, and pride. Thank your professors, the faculty and staff who put so much time and effort into teaching, guiding, and inspiring you. Do not also forget the men and women that took care of you in the campus. And thank each other, because you never would have reached this incredible day without the friendship and support of each other. You came of age under the shadow of several predicaments in the world. The COVID-19 epidemic that's ravaging through the world, the obvious vaccine inequity we are witnessing, the myriads of natural calamities, civil unrest and conflicts, widening inequities in healthcare, research and education, you name it. And only God knows what tomorrow will throw at your faces. I really hope that the education you have received at UGHE has prepared you to contribute what you can to tackle these inequities. That you will take advantage of these challenging times to strengthen your moral compass, and that you will combine the knowledge and skill you have gained to speak for the underserved and the voiceless, and advance the gift of science in the services of humanity. But all that is for tomorrow. Today it's about you, your joy, your pride, your achievements, and most of all, your well-deserved graduation. Let me conclude my remarks with a few last words. I hope they make sense. It's not just by coincidence or luck that you found yourself in this noble profession. There must be an inner reason or voice inside. It's now up to you to explore deeper and find that out, and make the best out of the long journey in front of you. Because once you do, man, what a journey you'll have. I offer you my best wishes and sincere words of congratulations in your success and happiness. I'm so happy to share in the excitement of your graduation day, and I'm so very proud of you. May I now invite the Vice-Chancellor of the University of Global Health Equity, Professor Agnes Binagwaho, to deliver her opening remarks. I thank you very much, and may God bless us all.
Honorable Minister of Education, Dr. Valentine Uwamariya, Honorable Minister of Health, Dr. Ngamije, dear Director of Africa CDC, Dr. John Nkengasong, Chancellor of the University of Global Health Equity, Dr. Paul Farmer, Deputy Vice-Chancellor in charge of Academic and Research Affairs and Dean of the School of Medicine, Dr. Abebe Bekele, Deputy Vice-Chancellor in charge of Administrative and Financial Affairs, Mr. Rogers Muragije. Special welcome to our local leaders and provincial leaders, the Governor of the North Province and our Mayor, faculty, financial and administrative members of the University of Global Health Equity, dear distinguished guests, students, family, friends, and supporters of UGHE, and finally, last but not least, our dear Lions, the MGHD students, class 2021. We are here together today for a very joyful occasion to congratulate the University of Global Health Equity MGHD class 2021. And it is my great honor to welcome you all this afternoon for the commencement ceremony. While we would have loved nothing more than to celebrate this important event together on our beautiful Butaro campus, unfortunately, COVID-19 pandemic and the aggressive variant virus have made it necessary for us to be separated over 6 continents. However, we are all united in spirit to celebrate you and what you have accomplished in the past year. Dear parents, UGHE friends and family, those before you today have taken the task and made the commitment to contribute to make the world a better place by improving access to quality health service delivery for all, with a focus on the most vulnerable as act of social justice, and to smoothly transform the world to improve the systemic causes of health inequities. Today, dear students, you have graduating. You are fully integrating the alumni family and the Global Health Network as our colleagues. Your passion for equity brought you at UGHE, and during the past year, you have been equipped with the theoretical knowledge and the implementation skills to contribute constructively to this mission. You have learned that national actions are needed to improve lives in the community, but that it needs to focus on the most vulnerable and the disadvantaged member of the community. COVID-19 has also told us that actions of solidarity and inclusiveness make a real difference in health and wellness. And when these are not present, the consequences are dramatic. So, I urge you to address this issue through solidarity, a collaborative mindset, and a multi-sectorial approach. Always have the overall objective to strengthen health systems to be more inclusive, human-centered, and equity-based. I urge you to apply these approaches in the workplace you will occupy and in the communities you will reside. You will continue to create resilient systems doing so, and you will impact the world because this approach, although local where you will live, will contribute to the worldwide promotion of social justice. To prepare you for this engaging work, UGHE has equipped you with the required tools to be advocate of inclusive holistic systemic change, with leadership and managerial skills to help you improve, create, lead systems to improve the lives of all, leaving no one out. It will not always be easy, but you will be helped by building and maintaining networks and partnership with people of goodwill. More importantly, always follow the best science of the day, including implementation science, to generate the best outcome in health of the population. You have been blessed to acquire the tools to analyze the real structural causes of unnecessary human suffering, to understand their context, and the evidence-based interventions to correct them with respect, durability, and human development in mind. As I conclude, I wish you to take away from UGHE the fruitful discussions, enlightening talks, incredible experience with your peers, as well as the network built with your fellows and other members of UGHE family, whose efforts have forged you into high-caliber graduates and great global health leaders. Apply the example that those caring for you have collectively shown you during days, every days, during this challenging time, during this unprecedented pandemic, when the entire UGHE family, together in our different capacities, have kept Butaro campus organized, clean, safe, functioning, transporting you across the country when needed, and procuring what you needed for your comfort. And they have taught you, teaching you with quality, caring with inclusiveness, flexibility, and innovation, while respecting science. You have seen here the recipe to make place and system resilient. Now, more than ever, it is your duty to go contribute to increase resiliency where you will work. On behalf of us all at UGHE, I wish you all success in your future endeavor. Remember, once lions, always lions. Thank you for your attention and congratulations. Dear colleagues, lions, friends and family, I'm honored to introduce you a close friend of UGHE and a dear colleagues, one of the Africa's greatest global health leaders of today, Dr. John Nkengasong. Dr. John Nkengasong currently serves as director of the Africa Center of Disease Control and Prevention, an institution of the African Union. In early 2020, he was appointed as one of the WHO Director General Special Envoys on CDC Preparedness and Response. In addition, Dr. Nkengasong was most recently awarded the Bill and Melinda Gates Foundation 2020 Global Goalkeeper Award for his fantastic contribution to the continental response in fighting the COVID-19 pandemic in Africa. Prior to his position, Dr. Nkengasong served as acting deputy principal director of the Center of Global Health and chief of the International Laboratory Branch Division of Global HIV and TB for the U.S. Center of Disease Control and Prevention. Dr. Nkengasong holds a master degree in tropical biomedical science from the Institute of Tropical Medicine in Antwerp, Belgium, and a doctorate in medical science from the University of Brussels in Belgium. Dr. Nkengasong has received numerous awards for his work, including the Shepard Award to the William Watson Medal of Excellence, the highest recognition awarded by the US CDC. He is also recipient of the Knight of Honor Medal by the government of Côte d'Ivoire and knighted in November 2018 by the government of Cameroon for his significant contribution to public health. He is an adjunct professor at the Emory School of Public Health in Atlanta, Georgia. He served on several international advisory boards, including the Coalition for Epidemic Preparedness Initiative and the International AIDS Vaccine Initiative, among others. And he has authored more than 250 peer-reviewed articles in international journals. He published also several book chapters. Please give a warm virtual welcome to Dr. John Nkengasong. He's going to give us his keynote address.
Greetings from the Africa Centers for Disease Control and Prevention at the African Union Commission based in Addis Ababa, Ethiopia. I would like to thank the organizers for inviting me to participate at this year's University of Global Health Equity graduation ceremony. Let me pause here to extend a very heartwarming congratulations to all the graduating students. The University of Global Health Equity, abbreviated UGHE's mission is to train the next generation of global health leaders with an emphasis on protecting the most vulnerable in Rwanda and the region in the variety of communities where the students live. UGHE is an institution at the front line of innovations in education and service delivery, whose main objectives are academic affairs, research, technology transfer, and community engagement and services. This year, UGHE is graduating its 6th cohort of Masters in Global Health Delivery students who represent 12 countries and these students will remain continuous learners who will accelerate the positive future of Africa. As innovation was a recurring theme of this year due to the pandemic, the university built upon its innovations to create alternative avenues to continue education. This is the first cohort to complete the new blended structure of Masters in Global Health Delivery, abbreviated MGHD program, where the first semester was 100% online. Education continues while the campus remained operational, and the university built on the existing remote learning infrastructure of which students and professors knew how to use and also integrated innovative softwares. The university acted efficiently because it knew the importance of education as a powerful tool for individual and social change, especially during a pandemic. UGHE is an independent university that, alongside programming, welcoming international students, is a building capacity within Africa. Through training deliveries by African and regional health experts to African learners to serve African populations and beyond. Leveraging the human resources for human capacity on the continent of Africa is needed to move equity agenda forward. We all know that the African continent bears over a quarter of the global burden of disease, but has very few health professionals to help combat this disease burden. However, today's commencement is a direct charge against this costly brain drain. Because UGHE has the eyes and equity, we are demonstrating the importance of quality, accessible education and healthcare to those who need it most. On the African continent, there is a growing understanding of the need to invest in the development of various health technologies, and UGHE is pushing for this innovation. The university is training the experts needed today to help develop the manufacturing capacity of tomorrow, creating new avenues for education and research to support the efforts of Africa to produce its own medicine and to advance its journey for self-sufficiency will save Africans and humans from the continent. I exhort each of you to take the unique knowledge you have learned at the university to be change makers, protecting the most vulnerable and improving health outcomes and social systems, starting with where your 2 feet are. I thank you for your attention, and once more, congratulations for being a graduate at this year's class. Thank you.
I would now like to give sincere greetings to the Honorable Minister of Health, Dr. Daniel Ngamije, who has been the Ministry of Health in Rwanda since February 2020. Before that, Honorable Minister Daniel served as a medical doctor at Kabgayi Hospital, Regional Director in charge of Health and Social Affairs in the former Gitarama province, and after he worked as the coordinator of the Malaria National Program and served as coordinator of the Single Project Implementation Unit of the Rwandan health sector. Finally, in June 2018, he joined the World Health Organization Rwanda Country Office as National Programmer Officer. Honorable Daniel Ngamije has completed his bachelor degree in medicine and surgery at the University of the Kinshasa in DRC, and a Master of Medicine in Public Health from the Université Libre de Bruxelles in Brussels, Belgium. Please join me in giving Honorable Minister Daniel a warm welcome for his remarks.
Honorable Minister of Education, Director of Africa Center of Disease Control, UGHE leadership and faculty members, distinguished guests, dear graduates, family, and friends, good afternoon. It is my pleasure to be with you on this special occasion to celebrate the milestone of another cohort of global health professionals. With the current COVID-19 situation and its variants, there is a need to ensure that health professionals are trained to be innovative in equitable global health delivery and to ensure that medical discoveries such as COVID-19 vaccines are available to all. They need to be equipped to develop, manage, and adapt health systems that respond to urgent issues and those of the future. As we prepare for future health crises, it is crucial to have a workforce equipped to deal with this with a human-centered approach to ensure that we care for one another as we continue to strengthen our healthcare system and as we innovate and use new technology and sciences. We must ensure that our future workforce prioritize equity, inclusion, and accessibility in their daily practice of delivering health to those in need. Dear graduates, the Master of Science in Global Health Delivery is an innovative program that trains health professionals in practical skills to be able to solve critical issues like COVID-19. The pandemic has especially showed us the importance to rely on research and data science for guidance in making evidence-based decisions. Thus, we are glad that research is an essential part of this master program. Solidarity is needed now more than ever, and UGHE shows that it is a center of excellence in Africa, globally, advancing regional education cooperation for leveraging community health and addressing social, economic, and political determinants of health through community-based research, teaching, and service. Thus, I congratulate you all on gaining this important knowledge and skills from UGHE. Dear graduates, the perseverance, willingness to learn, commitment and diligence you have taken to complete this degree are the same qualities you will need as you become advocates and activists for equity in healthcare. Celebrate your achievement safely, and especially in such COVID times, and go forth with the knowledge instilled in you from UGHE and place your mark in advancing equitable healthcare and systems in your communities, regions, and in the world. Once again, my sincere congratulations, class of 2021, and I wish you all success in your upcoming journeys ahead. Thank you so much.
We will now hear the remarks from the Honorable Minister of Education, Dr. Valentine Uwamariya. Dr. Valentine Uwamariya is the Minister of Education in Rwanda since February 2020. Before joining the ministry, she was the Deputy Vice-Chancellor in charge of training, institutional development and research at the Rwandan Polytechnic. She was responsible for providing science and technology-based vocational training. She is passionate about promoting research and technology and disseminate their findings to foster national development. Honorable Minister Valentine holds a Bachelor of Science in Chemistry from the University of Rwanda. In 2005, she got her master's degree in chemistry from Witwatersrand University in South Africa. In 2013, she obtained her PhD from UNESCO IHE and Delft University of Technology in the Netherlands. Honorable Minister Valentine has been involved in teaching and research for 19 years at the University of Rwanda, and served as Dean of the School of Science at the College of Science and Technology. Besides being a senior lecturer and a researcher at the University of Rwanda, Honorable Minister Valentine has held other important responsibilities in Rwandan society and sat on boards of local companies. Please join me in giving Honorable Minister Valentine a warm welcome for her remarks.
Honorable Minister of Health, Head of Africa CDC, Chancellor of UGHE, Vice-Chancellor of UGHE, Deputy Vice-Chancellors, distinguished guests, friends, faculty and staff of UGHE, MGHD 2021 students and their families. I'm very pleased to be given the opportunity to make these remarks at this University of Global Health Equity Masters of Science in Global Health Delivery 2021 graduation ceremony. It is my pleasure and privilege to congratulate all the graduates for this tremendous achievement. It is a major milestone in your lives, something to cherish, something to be proud of. The importance of delivering quality education and development of human capital is central to Rwanda's vision of becoming a prosperous knowledge-based economy. This is clearly articulated in key national policy documents, such as the National Strategy for Transformation, and is regularly reiterated and reinforced at all levels of governments and institutions. The University of Global Health Equity is a cutting-edge institution that advocates for equity in health and strives to deliver equitable, quality, and holistic health services for all, understanding that equity-driven education and the direct provision of care go hand in hand. In this regard, UGHE is in a direct alignment with the mission of the Ministry of Education that also works to develop the country by ensuring equitable access to quality education in order to promote science and technology. Honorable Minister of Health, Head of Africa CDC, Chancellor of UGHE, Vice-Chancellor of UGHE, Deputy Vice-Chancellors, distinguished guests, MGHD 2021 students and their families. The past year and a half of the pandemic has been termed the lost years for learning. We know that the loss of academic years delays the attainment of knowledge and skills and negatively delays future opportunities. However, with the use of innovation and implementation of systematic distance learning to carry out on teaching when necessary, as well as through strict adherence to the COVID-19 guidelines of the Government of Rwanda and the Ministry of Health, the University of Global Health Equity was able to continue education. This brings us here to the great accomplishment of MGHD class of 2021 students. The continuation of your education through a global pandemic has prevented students from losing years of learning. Even through uncertainty and adversity, UGHE emphasized the importance of continuing to implement innovative education approaches with strict adherence to the government restrictions. It is this innovative approach that unceasingly improves the creation of outstanding global health leaders and professionals such as you. UGHE gives great assurance to the Ministry of Education, with which it works alongside to develop these innovative ways of teaching health professionals in Rwanda during the pandemic and beyond. The multidisciplinary approach that UGHE adopts allows students to contribute to future generations' well-being because you are equipped to recognize and mitigate the multifaceted disparities populations face during and between global crises. Dear graduates, during your matriculation, you gained access to a revolutionized educational approach to global health through a quality education system that integrated the community into all aspects of the curriculum. You also benefited from an education that ensured that core skills needed in your professional life, such as leadership, management, and communication, are taught throughout all programs to ensure we train holistic, knowledgeable health professionals equipped with all the critical practical skills. We know that students who have been educated and initiated in disciplines of other sciences are more equipped to face current and unexpected challenges and implement comprehensive innovations. This is important because COVID-19 has shown the need for adopting transdisciplinary medical education to ensure successful outbreak management and sustainable health management for future health threats. As I am concluding my remarks, I would like to congratulate again today's graduates of the Master of Science in Global Health Delivery. In such an unprecedented time as this, you persevered and welcomed the challenges, and the world has shown that the need for an education that puts equity first is the only way forward. I hope that you can apply these skills you have gained at UGHE as you take your next steps in your careers to improve and advance health. Thank you. Let us all work together to prevent COVID-19 infections.
Honorable Minister of Education, Dr. Valentine Uwamariya, Honorable Minister of Health, Dr. Daniel Ngamije, Governor of the Northern Province, Madame Dansir Nyirarugero, Mayor of Berea District, Madame Marie Chantal Uwanyirigira, Dr. John Nkengasong, our keynote speaker, Chancellor of the University of Global Health Equity, Dr. Paul Farmer, Vice-Chancellor of the University of Global Health Equity, Professor Agnes Binagwaho, Deputy Vice-Chancellor, Academics and Research Affairs, and the Dean of the School of Medicine, Professor Abebe Bekele, UGHE Board of Directors, faculty and staff of the University of Global Health Equity, distinguished guests, graduates, parents, friends, and family of UGHE. I would like to congratulate our students, the reason we are all here today. They have taken a tumultuous year globally in their stride and shown us what strength in adversity looks like in successfully completing and exceeding all expectations for the academic year at the time when many institutions globally had been closed. They have been adaptable, measured, quick to innovate with evolving measures, and above all, unwaveringly committed all behaviors you would hope to find in the next generation of global health leaders. Hailing from 12 different countries, the diversity of this cohort will support them to forge bridges between geographies, disciplines, and cultures in their next chapters, striving for the global solidarity that has been absent throughout this pandemic. Let's take a moment to hear from some of our new graduates, which will be followed by remarks of the class representatives. George Mkondo, a new graduate from the MGHD track in One Health, an approach that considers animal, human, and environmental health. On the day of his graduation, his mission is clear: to help drive forward the decentralization of health systems in sub-Saharan Africa, to ensure wider access to critical health services to improve the health outcomes for the marginalized groups. It will be followed by remarks by an MGHD health management graduate, Oveka Yana, a Malawian registered nurse, midwife. True to UGHE's overriding mission of health equity for all, Oveka is passionate about ensuring that every mother and newborn have access to comprehensive, quality, and dignified health care.
My biggest takeaway is that health systems everywhere in the world can be challenged and changed for the better.
My biggest takeaway is that our world is connected in ways that we can't imagine. We're getting there. #One Health.
Is the importance of health data for evidence-based decision-making.
She is the importance of teamwork and accountability.
We need to think out of the box that how we can connect community needs with relevant partners and programs with sustainable solutions.
There are always innovative problem-solving techniques to build a stronger and resilient health system.
There should be more advocacy for policies and resources that address barriers and lift community health.
My biggest takeaway from UGH is how willingness and focus can help address the challenges we face.
It's the importance of multi-sectoral approach to address global health challenges.
From my MGHD colleagues, I have learned the value of being open to new and different ideas in our journey to change the landscape of healthcare delivery.
Disease prevention and management require a holistic approach.
Cultural differences and the power of teamwork.
I learned the beauty and power in diversity.
Health challenges are enormous, but we can easily surmount them through an integrated approach.
I have learned that there is beauty in professional and cultural diversity.
I learned the beauty of diversity.
From my MGHD colleagues, I learned that teamwork makes work work.
From my MGHD colleagues, I discovered new genres of African music.
Honorable Minister of Education, Dr. Valentine Uwamariya, Honorable Minister of Health, Dr. Daniel Ngamije, our keynote speaker, Dr. John Nkengasong, Chancellor of UGHE, Professor Paul Farmer, Vice-Chancellor of UGHE, Professor Agnes Binagwaho, Deputy Vice-Chancellor, Academic and Research Affairs, and the Dean of School of Medicine, Professor Abebe Bekele, Deputy Vice-Chancellor, Administrative and Financial Affairs, Mr. Rogers Muragije, dignitaries of Burera District, UGHE Board of Directors, faculty and staff of UGHE, distinguished guests, graduates, parents, family and friends of UGHE, all protocols observed. It is an honor for me to stand before all of you today. Our journey started off in not the most conventional of circumstances due to the COVID-19 pandemic. The majority of us were new to online learning and were concerned about how we would manage. Fortunately, the UGHE online learning platform was both sophisticated and user-friendly, making the transition to the new normal seamless. In January 2021, we finally made our way to Butaro, and I must say, pictures do not do justice to the beauty of this place. We were privileged to be under the tutelage of renowned faculty from all over the world. I would like to thank them for their professionalism and willingness to assist us every step of the way. Through your guidance and mentorship, we have learned to adapt to the forever changing situations in both our professional and personal lives. You are the best. Our cohort comprised 12 nationalities, and as such, many of us arrived here as strangers, but I am proud to say we live here as family, and for that I am eternally grateful. Such diverse professional and personal backgrounds set the tone for the importance of teamwork, patience, and accountability. We were introduced to the fascinating field of One Health, a transdisciplinary approach showing the interconnectedness of human, animal, and environmental health. Part of this module involved field visits to different parts of Rwanda, where we observed firsthand how these three sectors influenced each other. During this time, we engaged various stakeholders, including local communities, mining companies, and wildlife authorities, with the aim of understanding the challenges they faced, and we exchanged ideas on how they can thrive sustainably using a One Health approach. The fieldwork experience was one of the most exciting and fulfilling parts of the program. In our various teams, we carried out research that we hope will change the way healthcare is delivered, especially to the most vulnerable. As with any project, we had our highs and lows, but we managed to overcome any challenges like the true lions that we are. To you, my peers, I have two requests. Firstly, go into the world and be the leaders you have been trained to be. Be the voice of the voiceless. Secondly, please don't miss me too much, because I assure you we will meet in the future. Lastly, to the hospitality team, I would like to say thank you for making our stay pleasant. To the campus operations team, thank you for keeping this place running. And to the kitchen staff, Murakoze Chane for Pizza Tuesdays. I would like to also thank student and health services, admin and facilities teams, as well as everyone working behind the scenes. Your hard work does not go unnoticed. We appreciate you and hope you continue to do the same for those who come after us. Thank you.
The Honorable Minister of Education, Dr. Valentine Uwamariya, the Honorable Minister of Health, Dr. Daniel Ngamije, our keynote speaker, Dr. John Nkengasong, the Chancellor of UGHE, Professor Paul Farmer, the Vice-Chancellor of UGHE, Professor Agnes Binagwaho, the Deputy Vice-Chancellor, Academics and Research Affairs, and the Dean of the School of Medicine, Professor Abebe Bekele, the Deputy Vice-Chancellor, Administrative and Financial Affairs, Mr. Rogers Muragije, dignitaries of Burera District, UGHE Board of Directors, faculty and staff of UGHE, distinguished guests, graduates, parents, friends, and family of UGHE, all protocols observed. Good afternoon, everyone. We are living in a time when many students around the world have had their studies suspended due to the COVID-19 pandemic. But for me and my fellow graduates here present, we've been able to pursue our masters throughout, supported by UGHE's network of staff, faculty, and bold leadership. If the pandemic has taught us one thing, then it is the unpredictability of life and the need to adapt with agility, equity, and resilience in fast-changing environments. There is a saying that goes, "The same fire that melts the butter hardens the egg." Indeed, it is my belief that this very same pandemic that has devastated health and socioeconomic systems has ignited our resilience, innovation, and zeal to counter its effects and still ensure health equity for all. I therefore implore all graduating Lions to learn from the pandemic that we have learned through and go out as global health leaders who see challenges as opportunities for change and gaps as channels for growth. UGHE has taught us that there is beauty in diversity, and this is evidenced by the inclusion of 12 different nationalities in our cohort. We have learned to appreciate our similarities and respect our many differences alike. We have even learned new words such as the famous matula from Malawi, or the greeting, how far, from Nigeria. We now go back to our countries as a formidable force that is sure to deliver widespread impact on the continent and beyond. This would not have been possible without our outstanding lecturers, who through their unwavering dedication and commitment have equipped us with the knowledge and skill to view global health in a different light and challenge the status quo towards a world of social justice and health equity. We owe our profound gratitude to you as we now come out as lions, ready to lead prides and hunt down health inequities. Allow me to extend our heartfelt gratitude to the kitchen staff, who were always pleasant and kept surprising our taste buds with unique cuisines. Who knew that chicken and chocolate could go together? A special vote of thanks should also go to the student services, health, hospitality, IT, and security teams, who ensured that our stay at the Butara campus remained comfortable, safe, and exciting. Last but not least, I am honored to extend a special vote of thanks to UGHE's Chancellor, Professor Paul Farmer, Vice-Chancellor, Professor Agnes Binagwaho, and Deputy Vice-Chancellors, Professor Abebe Bekele and Mr. Rogers Muragije, whose combined passion for health equity have grown and led this university on a continent where health equity is needed the most. Your passion for health and social justice has taught us that every life is worth going the extra mile for. We are deeply inspired and intend to do the same. So here we are, 1 year and countless COVID tests later, ready to go out and implement the things that we've learned both in and out of class. But what next? A question that can only be answered by our individual goals and aspirations. Among the graduating class, we have the next Director General of the World Health Organization, future Ministers of Health, and even the next Vice-Chancellor of UGHE itself. Remember that the sky is not the limit because there never was one. Though the year may have been long and hard, we're proud to have walked through the corridors of this university and amassed the knowledge and tools for the journey onward. We can now walk out strong and ready for the challenges that lay ahead. Thank you very much. Ziko Mukwambiri, Murakoze Chiane.
As our network of UGHE alumni grows every year, so does its impact. Equipped with diverse skill set and management training provided by their year at UGHE, our alumni are now contributing to repairing and strengthening national health systems around the world and advancing health innovation and discovery as compassionate global health leaders, innovative researchers, scientists, implementers, health entrepreneurs, and managers. As advisors of health ministries, consultants to global bodies like the World Health Organization, educational advisors, research associates, and managers of programs in community health, nursing, non-communicable and communicable diseases, and mental health, to name a few. It's clear our own pride is helping change the status quo for those historically, economically, socially, and geographically left behind. As the 23 students of this year's cohort take their first steps into the uncertain yet hopeful world, our alumni share a message of encouragement, of solidarity, and shared commitment to global health equity. We hope you enjoy watching.
Dear Lions, congratulations, you are graduating from UGHE. I wish you success in the journey ahead. Please join us on the front lines as we fight against these emerging and re-emerging acute pandemics. Let's work together to establish the needed global health security.
Huge congratulations, class of 2021. In all you do, don't forget to keep the communities you've met along the way and the lessons they've taught you at the center of all your efforts to ensure health equity. Chori Kukwe.
I want to wish you all the best as you graduate and join the global community. Don't be afraid, give your best, and I believe your impact will be felt.
I wish you all the best, and I look forward to all the positive impact that you'll make in the global health arena especially. And I know that UGHE has excellently prepared you for this. Once again, congratulations.
First, congrats. You have gained skills and experiences that can be game changers in any field. So be confident, put yourself out there, and don't forget about equity.
Congrats, fellow Lions, you made it. The world needs you now more than ever. Join the UGHE alum as we try to make a positive impact. And remember, the sky is no longer the limit.
Dear graduates, congratulations to all of you. You have come at the right time when the whole world needs your service in solving its prevailing problems.
Honorable Ministers, our keynote speaker, Governor, dignitaries of Burundi District, UGHE members, distinguished guests, friends, and family. We have 23 prospective graduates of the class of 2021, Master of Science in Global Health Delivery. Their graduation has been approved by the Academic Council, Academic Commission, and the Senate of UGHE. Before we begin our conferring of the degrees, I would like to invite our Vice-Chancellor, Professor Agnes Binagwaho, to lead our pledge. Will the students of the Master of Science in Global Health Delivery please rise?
Thank you to our great alumni for the encouraging video. Class of 2021, the UGHE Graduate Declaration you are going to do is a commitment to the highest standard of professionalism and ethical practice in your career. As taught during your study at UGHE, it is a promise and a commitment that you as a graduate of Masters of Science in Global Health Delivery will abide to University of Global Health Equity mission, vision, and values. We ask you all MGHD graduates to make this declaration publicly and enthusiastically in the presence of faculty, fellow graduates, family, and friends. Class of 2021, please repeat this pledge after me. I will be a global health professional who leads with intentionality, dignity, and integrity.
I will be a global health professional who leads with intentionality, dignity, and integrity.
I understand my responsibility and hold myself accountable to use this learning to contribute to the field of global health, especially to disadvantaged population.
I understand my responsibility and hold myself accountable to use this learning to contribute to the field of global health, especially to disadvantaged populations.
I will maintain the utmost respect and compassion for human life, human rights, and human dignity.
I will maintain the utmost respect and compassion for human life, human rights, and human dignity.
I will deliver my services with equity and excellence.
I will deliver my services with equity and excellence.
I will promote and practice long life learning and research in global health.
I will promote and practice lifelong learning and research in global health.
I make these promises solemnly, freely, and upon my honor. So help me God.
I make these promises solemnly, freely, and upon my honor. So help me God.
Congratulations.
Honorable Ministers, distinguished guests, and faculty and administration of UGHE, I have the honor to present to you these candidates who have fulfilled the requirement of the Master of Science in Global Health Delivery. Students, I hereby confer upon you the degree of Master of Science in Global Health Delivery. These are the names of our graduates. Bashar Abubakar. Caroline Achin Alain. Yokai Chikwenere. Elisa Dushime. Bilkis Idris. Ishima Leone. Oveka Jana. Ahmed Flatbetter Cologne. Kampiri Happy Tahiri. Samuel Semenfeskudus Kidani. Madaliso Irene Nkata. George Tavonga Mkondo. Dorothy Nkweza Lamba. Rashida Nembaszira. Valentine Uwamariya. Elisa Ndatinya Grace. Niteka Elisa Gahola. Gloria Rukomesa. Ferdinand Ramwejo. Joseph Bangali Sise. Samai Desta Shamebo. Natnel Zimakun Shimelash. Wilfred Whittle. University of Global Health Equity recognizes students who have achieved outstanding academic performance. We're here to celebrate our MGHD students who have earned the highest grade point average of this cohort. So the highest academic performance for the Master of Science in Global Health Delivery in the One Health option is presented to Nagnil Samakun Shimalesh. This is what Nagnil said about UGHE. My educational experience at UGHE has bolstered my technical knowledge and confidence to pursue my career aspirations in humanitarian work, health education, and transdisciplinary research. The interactions I have had, the network I have developed, and the challenges I have maneuvered at UGHE have transformed me as a person and offered a perspective towards my professional aspirations. And the highest academic performance for the Master of Science in Global Health Delivery program in the Health Management option is presented to Fernand Guamwejo. Congratulations. This is what Fernand said about the program. Through courses like the Principles of Global Health Equity, I learned more about the use of a holistic approach in achieving equity in healthcare, which changed my perspective as a clinician to not only look at a patient's condition, but to address social determinants of health that prevent people and communities from achieving their full potential.
Now, let us welcome our dear Chancellor and co-founder, Dr. Paul Farmer, who by training is a medical anthropologist and who has dedicated his life in improving healthcare for the world's most vulnerable people. He is also co-founder and chief strategist of Partner in Health, that since 1987 has provided direct healthcare services and undertaken research and advocacy activities on behalf of those who are sick and living in vulnerability. Paul and his colleagues have been at the front of novel community treatment and all strategies to bring quality services to the most vulnerable across the world. Welcome, Paul, for your remarks. And please, all of you, join me to welcome Paul.
Hello, dear graduates, and congratulations to you and your families. This is the first time I've been out of Rwanda at graduation time, and the second I've been obliged to make remarks from off campus. Last year it was COVID-19, which continues to roil our world in unpredictable and foreseeable ways, as it will for years to come. But this year, I'm reporting in from Haiti, which has been stricken over the past 2 months by a number of disasters, best termed unnatural. How so and why? After all, an earthquake and a tropical storm are surely natural disasters. But every UGHE graduate, and likely all of our students, know that we're living in an era now widely termed the Anthropocene. One common definition of this epoch, which you can look up online, is the period of time during which human activities have had an environmental impact on the Earth regarded as constituting a unique geological age. Why am I confident that you would all know the definition of a term coined so recently, a term hardly known in my country or across Europe, where so many of the problems of our planet originated? You graduates know that many of these problems will clearly shape our future prospects, and they are already changing the epidemiology of pathogens ranging from malaria to the coronavirus that causes COVID-19. No one knows this better than Dr. John Nkengasong, who now inhabits a leadership role that one or more of you may inhabit in the future. It's the future, of course, that you will inhabit longer than Dr. John or Vice-Chancellor Binagwaho or I will. And because you're UGHE graduates, you know the point of your studies and of much of your current and future work is to grasp a broad biosocial and ecological view of health disparities and to learn how they might be best addressed in the here and now. When we use the term One Health or draw on the older paradigm of social medicine, we're referring to medicine and public health in the Anthropocene, in all its complexity and glory, all its pain and promise. There are several reasons I'm in Haiti today and not in Butaro, but all of them, whether I invoke earthquakes or storms or COVID, are related to the human-wrought changes that now conspire to affect geological change itself. What we see here in Haiti in the coming days and weeks will likely not surprise you. There is trauma, seen and unseen. There are everyday health problems that strike us mortals, whether we're in an earthquake zone or not. I wouldn't be surprised if cholera rears its ugly head, along with other waterborne diseases. We should be ready for cases of tetanus, even though no one, surely, should get that reliably vaccine-prevented and horrible and often fatal disease. There's already been at least one case in southern Haiti, and who knows how many we will miss. There is, after all, one thing that binds you graduating together today. You all inhabit the same beautiful, varied, and imperiled planet. We all do. Be mindful of these threats going forward, but let's take time right now to celebrate your achievements and the mere yet wonderful fact that you come together today from across Rwanda and from Nigeria, Malawi, Pakistan, Kenya, the DRC, Zimbabwe, Sierra Leone, Burundi, Ethiopia, and Liberia. Indeed, students now studying at our beautiful campus, or soon to arrive, hail from every continent except Antarctica. We pity the penguins. Let me close by paraphrasing the First Lady of Rwanda, who, along with Dr. Sunait Fasea, chairs our Africa Advisory Board. We met just 2 days ago through Zoom. As always, the First Lady underlined the role of the young and of women and girls, who we know will make a great difference in how we all might flourish during the Anthropocene. Again and again, she underlined the importance of service, dignified service, to the ill and the imperiled. If we want to decolonize global health, we will all start by fighting for some things that colonial rulers did not: dignified medical services and higher education. Making our dreams of service, training, and relevant research a reality is the best way to decolonize global health. Moreover, it's the best way to enshrine the legacy of Rwanda's Renaissance, which has come to pass during the Anthropocene. Think a bit about how improbable that Renaissance was and how wonderful it could be. Looking at your class, dear UGHE Lions, gives me great confidence in our uncertain times. It gives me confidence even in the most difficult circumstances. So akazi keza, dear graduates, and murakoze cyane.
Congratulations once again to the MGHD class of 2021. You have demonstrated a strong ability to overcome by completing this rigorous program in the midst of the COVID-19 pandemic. On behalf of those present here today, the administration of UGHE, and most importantly, the communities that you will serve, I strongly urge you to use the skills and knowledge you have acquired in this MGHD program to respond to the pressing global challenges of our time and reduce inequities in healthcare delivery that still exist in the world today. I would like to express my gratitude to our guests, Honorable Minister of Education and Honorable Minister of Health, our keynote speaker, Dr. John Nkengasong, distinguished guests, parents, friends, and family of UGHE for tuning in from across the world and for being with us today in this graduating ceremony. Congrats once again to our MGHD class of 2021. This brings us to the close of our 5th MGHD commencement ceremony. I wish you all a wonderful rest of the day. And for those who wish to remain behind, we will be playing a virtual short clip of our virtual campus tour. Thank you.
Hello to everyone following us today. Thank you for tuning in. Welcome to University of Global Health Equity. Before we start, I'd like to give an overview of who we are and what we stand for. UGHE is a global health science university based in Rwanda with a bold mission to radically change the way healthcare is delivered around the world by training generations of global health professionals to deliver more equitable, quality health services for all. We have, as you're about to see, a state-of-art campus in rural Rwanda. We are reimagining the future of global health education through evidence-based practice and direct learning from the communities. Our students engage in field-based learning and hear directly from community members and community health workers. They learn to approach their work with cultural humility, equity in mind, and embedded in practice, and a sensitivity towards the historical, economic, or social challenges faced by these communities. Our beautiful campus was inaugurated in January 2019 by His Excellency President Paul Kagame and our Chancellor and co-founder, Dr. Paul Farmer. The campus is currently hosting the first and second year medical students who are enrolled for 6.5 years, the 6th cohort of master's students, as well as faculty and staff.
Our clinical simulation center is an interactive learning facility that helps our students practice different patient care scenarios. So its design includes 2 debrief rooms, 4 control rooms, 2 individual exam rooms, 1 anatomy room, and 1 large flash studio that can serve as a bed ward, a delivery room, an ICU unit, or an operating room. We now enter in one of our delivery rooms. I'm going to introduce you to Mutoni and her newborn baby Shema. So Mutoni is a high fidelity mannequin that can be programmed to simulate realistic patient scenario. You can practice a vaginal delivery on Mutoni, you can conduct a cesarean section. Students come here or practice different physical examination on Mutoni. They can auscultate for her lung sounds, her cardiac sounds. They can do different medical procedures. So students usually come here and practice different procedures. They can also come here and learn how to do a physical examination of a newborn baby, how to provide a breathing support to a baby who's struggling to breathe after birth. And now you see she's crying. Maybe she's hungry. This is our intensive care unit. This room is not only used by our medical students, but also is used to strengthen medical workforce in Rwanda.
The Health Services Department has been one of the key contributors to ensure the campus is still free of COVID-19. This includes on and off campus COVID-19 mass testing and regular checks for the health status of campus residents.
Here we are at a lovely viewpoint. In the distance, you are able to see the Butaro District Hospital, one of the partners in health-supported hospitals in the country. It will be soon undergoing its transformation into an accredited teaching hospital to expand clinical services, serve more patients, and create world-class teaching environment for UGHE students and other medical students from the region. If you are visiting in person, this is where we would end our tour. But before we go, I want to show you what has been taking my time lately. Do you see construction going on there? Follow me there. We are now at the site where the second phase of the campus construction is taking place. Representing the next step in our journey to transform health education, we are currently undertaking a significant campus expansion. We are increasing our space to serve more learners, offer new degrees, increase the quality and quantity of biomedical research in sub-Saharan Africa, and provide improved medical training and support hundreds of regional physicians, nurses, midwives, community health workers, and other health professionals from Africa and beyond. Thank you for following us. I hope you get to see this soon in person.
We are forever grateful to our compassionate partners, donors, staff, faculty, leadership, and governance who continue to support our critical global health equity mission now and in the future. Thank you so much for following us. Murakoze cyane.